The resurgence of measles in Europe is a stark and troubling reminder of what happens when public health systems become complacent and vaccination coverage declines. The 787% surge in reported measles cases across the European Union and European Economic Area, EU/EEA, in 2024 is not just an alarming statistic. It is a clear sign that the continent is experiencing a major public health setback. After decades of progress and widespread belief that measles have been largely controlled, Europe now finds itself grappling with a disease that is not only entirely preventable, but also dangerous and in some cases deadly. According to the latest data from a European Center for Disease Prevention and Control, ECDC, 35,212 cases of measles were reported across the EU/EEA in 2024, an astronomical jump for the 3,973 cases reported the previous year. What makes this spike especially concerning is that it has exceeded even pre-pandemic levels, despite the improved surveillance and health infrastructure that one would expect after the lessons learned during the COVID-19 crisis. Only 2 countries in the entire region, Latvia and Liechtenstein, reported no cases. The rest saw sharp increases, some more dramatic than others. Perhaps the most egregious example is Romania, which accounted for nearly 87% of all measles cases in Europe in 2024. The country's vaccination coverage is disturbingly low, with only 78% of children receiving the first dose and just 62% completing the second. These numbers are far below the threshold needed to achieve herd immunity, which for measles must exceed 95% due to the virus's extreme contagiousness. Measles has an R0, basic reproduction number, of up to 18, meaning one infected person can transmit the virus to up to 18 others. For comparison, the highly infectious Omicron variant of COVID-19 has an R0 of 8 to 9. Measles is therefore one of the most contagious diseases known, and the only effective protection is high and sustained immunization rates. The consequences of this negligence are not just numerical, they are human. In 2024 alone, 23 people in the EU/EEA died as a result of measles, including 22 in Romania. These deaths are not inevitable tragedies. They are preventable losses. They occur despite the existence of a vaccine that is both safe and highly effective. Moreover, the increase in hospitalizations, which reached 79% of reported cases, indicates not only the severity of the symptoms, but also the strain that this resurgence places on already burdened healthcare systems. Among the hospitalized, pneumonia, ear infections, and encephalitis, serious and sometimes irreversible complications, were commonly reported, particularly among unvaccinated individuals. Another deeply worrying trend is the fact that the majority of the cases originated from within the EU/EEA rather than being imported. This indicates that the virus is circulating locally, sustained by pockets of unvaccinated or undervaccinated populations. While Spain maintains a relatively high vaccination rate of around 96%, it is not immune to the spillover effects of outbreaks in neighboring countries. Imported cases, when introduced into areas with even minor lapses in vaccine coverage, can ignite outbreaks, particularly among vulnerable adults who may have missed immunizations decades ago or children whose parents refused vaccination. The ECDC's data shows that 87% of all measles cases in 2024 were in unvaccinated individuals, and this figure jumps to 90% among children aged 1 to 4. This is a damning indictment of vaccine hesitancy and misinformation. Measles is not a harmless childhood illness. It can cause long-term neurological damage, developmental regression, and in some cases death. Despite all scientific evidence to the contrary, anti-vaccination rhetoric has gained traction in parts of Europe, often amplified through social media, political movements, or misinformation campaigns. The consequences of this disinformation are now visible in hospital wards and public health records. This crisis is not just a Romanian problem or a problem for low-coverage countries. It is a European problem. Measles does not respect borders. The ECDC is now urging countries to strengthen cross-border cooperation, share immunization records, and conduct medical checks even for intra-EU travel. These are necessary but reactionary measures. The real solution lies in restoring trust in vaccines, bolstering public health outreach, and implementing mandatory vaccination policies in areas where voluntary programs have failed. If anything, this resurgence should serve as a wake-up call that the fight against vaccine-preventable diseases is never over. The gains made over the last decades can vanish quickly if vigilance wanes. As we have seen, measles is not just back, it is back with a vengeance, and it is exploiting every gap in our collective defenses. The health community must respond with urgency, clarity, and resolve, not only to stem the current outbreak, but also to prevent future ones. That means recommitting to vaccination, confronting misinformation head-on, and ensuring that every child, adolescent, and adult has the opportunity and the encouragement to be protected.